We're going to go ahead and get started. Let me bid everyone a good morning and thank everyone here and on the phone. I want to thank everyone in Denver who stayed home this weekend. You helped save someone's life, maybe your own. There are a couple items that we want to get started with today. First of all, I know today is 420, and Civic Center Park is usually the center of people's gathering today. But I want to remind everyone that Civic Center is closed. Do not come to the park. It's also National Volunteer Week, and I just want to take a moment and thank everyone who has volunteered over the past over the past month, working in our shelters and delivering food, or just giving some of their time to help people during this stay-at-home period. Also, these volunteers are unsung heroes, and we can't thank them enough for all that they're doing for us in this city and across the country. I also want to express my sincere appreciation to our police officers. I see Chief Payson is here. Thank you, Chief. Sheriff deputies and firefighters who continue to put themselves in harm's way to support all of us right now. And as you saw on display yesterday, when they had to put themselves at risk of exposure to this virus, but they were still on post to make sure everyone was safe. And so we want to thank our police officers in particular for being there yesterday. I also want to thank the healthcare workers, doctors, nurses, and paramedics, and so many others who are warriors in the fight against the virus. Thank you to the Department of Public Health and Environment, Public Health Investigations. Bob McDonald is here, our Executive Director, which has been working around the clock to ensure citizens remain safe during this extremely challenging time. And finally, I want to thank the people of Denver who have done their part not to create gridlock, but to support our healthcare workers by staying at home, practicing physical and social distancing, and taking this virus seriously. We are greatly appreciative to you, and we know that all the success we're beginning to feel and see in terms of the curve on this virus is due to your diligence, commitment to serve and to protect everyone. Sadly, nearly 100 people in Denver have died from this insidious virus, many of them in nursing homes and long-term care facilities. I'll talk more about that in just a moment. There have been about 1,750 positive cases in Denver so far, and we're thankfully on pace of new cases that appear to be slowing. Our hospitals are doing a great job keeping up with demand. About 80% of all hospital beds are available. 1/3 of ICU beds are open, and nearly 2/3 of ventilators are available for use. And a number of new hospitalizations also appear to be slowing. These are very encouraging signs that our efforts to stay at home and physically distance from one another are working. Now, as everyone is aware, we are coming to the potential end dates of both the Colorado stay-at-home order on Sunday and Denver's at the end of this month. This is a critical week for Denver and the metro area. We will be in close coordination with the governor and other metro area leadership, including public health directors, to determine whether the health care data we are seeing supports a phased relaxation of stay-at-home orders. Our team is busy planning for what lifting that order would look like here in Denver and around the metro area. We still have a lot of work to do over the next 7 to 10 days. Some of our biggest challenges are significantly increasing testing for COVID-19 and then testing for antibodies, as well as retraining and hiring staff for contact tracing. Those are the two top criteria that we talked about for weeks now in terms of how we can begin to loosen some of our orders here in the city of Denver. We're working on several scenarios to ensure this is a slow, phased, and controlled reopening. And it will have to be nimble enough so that if, God forbid, we see a spike in cases and we have to quickly reinstitute our orders. Now, I've been talking to business leaders over the last several weeks, and I believe everyone recognizes and understands that this will not be just a exercise of flipping the switch. This is going to be a gradual turning on the dimmer, has been used as an example, with many protective measures that have been put in place remaining in place until we have better control of the virus spread. We know our residents have questions about how long restrictions on large gatherings will be in place, and I can just want to be very clear and candid with you. We as a city should anticipate these restrictions to remain in place for a while, even after we are no longer to remain at home. This will be a different summer for those of us here in Denver, Colorado. And while we are intent on reopening public and economic life in Denver as soon as possible, public health is paramount and many restrictions must remain in place. We oftentimes get people who are, it's easy to get confused with this. There are two orders in place. One is a stay-at-home, which will set to expire April 30th here in the city of Denver. The state order says April 26th. And we also have a social distancing order that's in place and set to expire May 11th. That one regulates the gathering or large gatherings of individuals in the city of Denver. Again, set to expire May the 11th. Later this week, we will be updating and extending the public health order restricting large gatherings and large events in our city, and we will have more details on that hopefully by the end of this week. And again, we should expect, as residents of this city, as visitors to Denver, that these orders will remain in place for the foreseeable future to keep everyone safe. And we also know that people have questions about which businesses will be allowed to reopen when they will be allowed to reopen and how they will be allowed to reopen. There is not a topic of conversation that is greater than that question or those questions here in the city of Denver right now. And we'll all have more information to answer to these questions in the next several days. Again, I'll pinpoint the next 7 to 10 days are going to be critical here in the life of our city. In the meantime, I want to provide you with a few updates on this work. First, we want to remind our residents of the importance of physical distancing while in our parks. As you know, we are going to start restricting the use of shared equipment such as frisbees and footballs. We're still seeing too much of that in our parks. We want to get you outside. We want to get you fresh air. We want you to enjoy the sun. We understand the benefits of having sun on our faces and being able to get outdoors, but we need you to stay at least 6 feet apart and do not gather or travel in groups. This is for all of our well-being going forward. While those are more restrictive actions we're taking, we're also loosening others. As of Wednesday, all city-operated golf courses will reopen to the public, weather permitting, with strict requirements. And I believe, I know Happy Haynes, our Executive Director of Parks and Rec, is here in case there are questions, but you can go to the www.cityofdenvergolf.com to get more information on that. And I believe the private sector golf courses have shown us a lot of best practices on how we can keep people safe on the golf courses, and you'll see a lot of those recommendations or at least practices put in place on public golf courses. Next, I'm also proud to announce that the first $2 million or the $4 million for our businesses, our business relief fund, will be going out the door today. Eric Haraga, our Executive Director of the Division of Economic Development and Opportunity, is here to answer any questions you may have about that. And through our partnership with the Downtown Denver Partnership, to date, we've raised more than $400 million on top of the $400,000 on top of the $4 million through the generous support of our local banking and insurance industries. And we want to thank our private sector partners for coming forward with their support, as well as to the Downtown Denver Partnership membership. Our Denver Economic Development and Opportunity will be contacting grant recipients this week, and we're estimating that the first round of funding will support between 200 and 250 small businesses. Now, these are businesses located around the city of Denver, many of them in neighborhoods vulnerable to displacement, and about 60% of the recipients are women and or minority-owned businesses. Providing some relief to our businesses and workers is important to our planning efforts for reopening, and we're working now on the process to distribute the next round of grants in May. Finally, I want to take a moment to talk about what's happening in our nursing homes and our long-term residential care facilities. This is very important. As the governor, I believe, outlined last week, he noted that 40 to 50% of the more than 400 deaths in Colorado are linked to nursing homes and long care facilities. This is one of the more tragic and alarming aspects of this pandemic. My heart aches for the families of every one of the people who have died in the nursing homes and as a result of this virus around the state of Colorado and around the world. These residential care facilities are home to some of our oldest, most fragile, and most vulnerable residents, and we need to do more to protect them. I want to thank the governor for updating his public health order, requiring these facilities to create detailed isolation plans by May 1, and increase state support in the form of the National Guard and testing for these facilities. Denver also will be increasing our oversight of and support for long care facilities. Over the last 2 months, we have issued all 118 facilities in Denver at least 3 sets of public health orders, outlining policies, procedures, and protocols to keep their patients and staff safe and healthy. Yet as of this morning, 26 of these facilities have at least 2 positive cases among their patients, and 49 have at least 1 suspected or confirmed case in staff or resident. Clearly, as a city, as a state, we need to do more. We will be reassigning DDPHE staff for compliance visits to as many of these facilities as possible over the next 2 weeks. We'll be working with them to ensure they are following physical distancing requirements, and we will continue prioritizing these facilities for additional PPE testing and staff support. I want to again issue our deepest thoughts and prayers to all family members who have been impacted by this virus. Today, we know more than 1,760 families are dealing with positive cases of coronavirus in Denver. We've lost close to 100 people in this city. I don't know many families that have not been touched by this situation, either through the orders that have come or people in our families or loved ones who have been lost or who are dealing with positive cases. But know that there's nothing more important than, as a city government, that we are focused on than making sure that we keep all residents of this city safe and healthy. And so we really do. When I say I appreciate you staying at home, I mean it from the bottom of my heart. Thank you for staying at home. Before we wrap up, one of our primary focuses during this pandemic has been the increased support for our residents experiencing homelessness. You saw last week we opened an auxiliary shelter at the National Western Complex to relieve pressure on our shelter system so our providers can provide more physical distancing in facilities. Again, I want to thank our National Guard for coming to Denver to help us with our shelters and for their leadership and courage, and they're leaning in ways that we could never imagine, the men and women who are wearing uniforms to help us, as well as to our law enforcement who are on the streets every day, who are helping those most vulnerable find their way and to get services. We appreciate you as well because you're also putting yourself in the line of this virus. The governor and I have both made calls to our hotels and motels to open up rooms to these residents. The team has been working on securing around-the-clock efforts to take care of our homeless. This has resulted in more than 550 rooms being secured for use currently. And I want to thank those hotels and motels, motel operators for stepping up and being a part of our solution here in the city. Today, we will open a new auxiliary shelter for women at the Denver Coliseum. And I'm going to ask Britta Fisher, who is our Chief Housing Officer for the City of Denver, to come forward and update us on that auxiliary. Britta?
Thank you, Mayor. Today's opening of the Auxiliary Shelter for Women is very much a collective effort. It involves not only our city, but our provider community. We're fortunate to have a very strong network of shelters and service providers in place and want to appreciate the Homeless Leadership Council and the many members there who have been partners in this work all along. Last week's snowstorm provided a slight delay in the opening of the Women's Auxiliary Shelter. We wanted to ensure a solid start to what is already a complex logistical endeavor. Our plans are in place, and the weather is on our side today. And so we're looking forward to welcoming our first guests in a few hours. We'll be opening the doors of the Coliseum for intake at 2:30 this afternoon. What this means is that we will have room for up to 300 women and transgender individuals across the spectrum. They will have personal sleeping spaces of at least 60 square feet apiece. And there's plenty of room in the Coliseum for people to move around, have meals, and relax. The guests will also receive greater access to medical care. All the women will be screened at entry for symptoms by staff from the Colorado Coalition for the Homeless Stout Street Health Center. Testing is available for those who are medically advised to do so, and guests who are medically required to isolate will be transferred to our activated respite rooms. Through the Stout Street Health Center's satellite facility at the National Western Center, all guests will have access to primary health care, mental, and behavioral health care. So as our first guests begin arriving this afternoon, they'll be bused from other shelter locations, and walk-up access will also be provided. The hours for accessing this 24/7 shelter are from 8 a.m. to 8 p.m. in order to align with our medical screening for all guests at entry. The new shelter will absorb guest capacity for some of our existing overnight emergency shelters for women. This includes Catholic Charities Women's Emergency Services Shelter, which will be suspending operations, and those staff and guests will be at the Coliseum. And the Dolores Project, which is reducing its number of guests served in order to provide greater distancing at their current facility. The Coliseum is a 24/7 shelter, and with this day shelter in place here, the city will be closing the day shelter that was established some weeks ago at the Glen Arm Rec Center. So that will be standing down today after all of the guests have left. I just want to thank again the Homeless Leadership Council, the staff who've been redeployed to these shelter missions, and to our National Guard who are serving such an important role at long-time existing overnight shelters and day shelters and at activated respite and protective action rooms. We're very excited that to those 550 rooms that we've already secured, we'll be adding another 138 rooms this week and through our partnership with the Colorado Coalition for the Homeless. Serving people experiencing homelessness in our community is very much a collective effort, and I thank everyone for what they've done to step up for people in our community. Thanks.
Before we open a question and answer, I think it's always important to turn or hear the voices of those public health officials who we have a great deal of confidence in. Helping us to craft our decisions and these orders. And I just want to ask Bob McDonald to come up for a few seconds to give us a general update on Denver.
Thank you, Mayor. I want to share a couple of things. It seems like I share every week, but in my mind, that's actually good news. Every day when I come in, I look at the number of cases that we've had the previous day, the number of positive cases, and I'm pleased that I'm able to continue to share with you that we are definitely seeing a stabilizing of the number of cases that we've seen in Denver. I believe that our Joint Information Center will be sharing with a number of media outlets, with all of you, some charts that we put together that show the cumulative number of cases since we began this journey, but also a stabilizing of the number of cases that we see every day. In those areas, when you look at those charts, you see a little blip here and there, 100 cases one day, 90 cases in another day, when for the most part, you see around 50 to 60 or so, maybe 65 cases on average a day. When you look at those charts and you see those little blips, an increase in numbers, take a look at the numbers previous to that and the number of cases following that, and you'll see that leading up to those small spikes, if you will, you see the cases were very, very low. And then just following that spike, again, cases for the next 2 or 3 days was very, very low. That's a result of reporting, a delay in reporting. If you look at the number of cases on a 3-day average, you see that it's very flat. So I'm excited to be able to keep reporting that every week. And then the other chart that will be shared with you is the number of hospitalization admissions in comparison to the number of beds available. And I don't have the chart in front of me right now, but there are hundreds of available beds in comparison to the number of cases that we're seeing being admitted. Those are two very important criteria in terms of what we look at in easing up on some of the restrictions that we have in place. But I want to stress a couple of things here. When you look at those charts, it's easy to look at that and say, well, why did we do that? Did we do it too early? Did we need to do it at all? When I look at those charts, what it tells me is that we acted in time. We acted in time. That's why those numbers look the way they do, because we implemented those strategies in time, and now is not the time to be easing up. We want to continue to look at those numbers. I still, unfortunately, see a number of people out in public without face masks on, or face coverings, I should say. Please continue to wear those when you can. It's strongly encouraged, and it's a requirement for essential businesses, for personnel in essential businesses. So please continue with those efforts. That's what's going to keep those numbers down. And again, those criteria in terms of number of cases and hospitalizations, those are just two of a number of criteria that we'll look at in the upcoming weeks. Thank you.
Thank you, Bob. You get a sense of the voices that give us the leadership and confidence to make some very, very difficult decisions in the life of our nation every day. So we're going to go ahead and open it up, the lines for questions.
Mr. Mayor, good morning. This is Kyle Clark with 9 News. The language that you're using, the language that Governor Polis is using, suggests that lifting the state and the city's stay-home orders on their end date is pretty much a done deal. Is that fair to say?
No. I believe that there's still a lot of information, Kyle, that we have to receive. We'll get a lot of that, I think, starting today and throughout the week. Bob and his team and I will huddle along with the other team here. We'll talk to the governor. We got to talk to the regional leadership as well. So a lot of work has to be done. And so that's the language I want you to zero in on, is that over the next 7 to 10 days, we got a lot of conversations and data to pour over and a lot of tough decisions that have to be made.
Mayor, regarding the social distancing ordinance that expires on May 11th, I know that covers restaurants. What could we see in terms of restaurants reopening? Can they reopen, but might it be at a reduced capacity? And is it possible that ordinance is going to be extended?
Yeah, the order will be extended. You can bet on that. How it looks going forward, we're still putting that together today. I had a call last week with the Restaurant Association, and we had, quite a few restaurant owners and operators on the line. And I'll tell you, we were as open as possible in terms of the impact. They were as open as possible in terms of their impact and what they will be looking for. I can tell you that many of them have already started talking and thinking about and putting in place protocols for opening. And they wanted to share some of those with us, and they will share them with us. And many of those protocols, I'm sure, will become part of our easing into this. But you can bet that there will be some easing into this. Again, we're not going to just throw open the doors of restaurants and say, everybody come. We've got to be smart and thoughtful about this. The restaurant operators are in that same place. Though difficult, they're ready to help craft those opportunities around protocols. Some restaurants may not open until they're able to fully open. And so if we have let's say a 50% rolling open, and then we have to increase it to 75%, some may wait until it's 80% or 90% or 100% because of the diminishing returns based on their costs related to the percent of opening that they'll allow or will be allowed. So there's you get a sense of some of the difficult decisions and calculations we have to take in place here. And I know those restaurant operators, at least the ones we had on the phone, understand it and are ready to lean in and help us to craft those commonsensical approaches.
Mr. Mayor, to be able to stay in the new shelters at the Coliseum and at National Western and in the hotel rooms.
Let me have Bretta come up and answer that question.
Can I hear that question again, Donna?
How long will people be able to stay in these new shelters at the Coliseum and National Western and in the hotel rooms in the respite room?
Yeah, so exit strategy is something that we continue to discuss, but overall in the shelters, this is now the new site, and so there's assigned beds, and people are able to get those beds on an assigned basis, first come, first serve, and we'll continue to monitor all of the factors that have been discussed this morning as we think about what it will take to exit some of these strategies as well.
And you mentioned 550 rooms are available now. That's the city rooms, that doesn't include the Colorado Coalition for the Homeless rooms.
So the rooms that we are talking about, when I say 552 that are secured, that's inclusive of our partnership with the Colorado Coalition for the Homeless. As with adding the 138 rooms this week, that'll bring us up to 690 in total.
Hi, this is Connor from Westward. Happy Haynes, can we get some more information about what the strict requirements are going to look like for the golf courses reopening, and when should we expect City Park Golf Course to reopen?
Happy Haynes, Executive Director of Denver Parks and Recreation. Thank you for the question, a couple of questions. So there will be quite a number of protocols and restrictions in place for reopening golf. It includes reserving tee times in advance only by phone. So there will be no contact with our pro shops, which will be closed. The guests who arrive will be escorted by individuals when they arrive at the parking lot to give them the instructions on how to proceed through the course. They will go directly to the tee box. They will be asked to strictly abide by the 6 foot, minimum 6 foot physical distancing requirement at all times on the course, whether on the tees, on the fairways, or on the greens. We have taken a number of steps to eliminate the sharing of any equipment on the golf course. So the flags, while there, will stay in place, so they will not be removed. The cups will be covered so that as if your ball rolls over the cup, that is considered a hole out, and moving on to the next. We've removed all of the bunker rakes, ball washers, water coolers, anything on the course that traditionally has been used as common shared equipment. All of those will be off limits. Golfers are not to touch anyone else's golf equipment, so no borrowing the great driver that your friend may have. You have to use your own equipment. That includes bags, clubs, balls, tees, the pull carts. We will have carts available for rent. They will be limited to one person per cart, so no sharing of the carts. And we will be cleaning and disinfecting all of the carts after each use. The restrooms will be open. The clubhouses will be closed except for a visit to the restrooms, again following physical distancing requirements, and picking up food that is available only for takeout. So that's a brief summary of all of the restrictions that will be in place. City Park.
Hi, Rob Lowe, Fox 31 Denver.
Yeah, City.
Wanted to ask the mayor about.
As to City Park Golf Course, the course is coming along quite well. We intend to let it go through this next growing season, essentially over the summer, and our hope is to have it completed sometime near the end of summer or early fall.
This is Esteban Hernandez with Denver Right. Mayor Hancock, can you provide us an update on the city's PPE distribution process? I know that there was some concerns about the way that the feds were getting it to the city. So can you just give us an update on that, and also answer if Denver is getting enough PPE at this point?
Yeah, I'm going to ask Matt Mueller, who is our Executive Director of the Emergency Operations Center, to come forward and update us. He and his team manage that effort.
Thank you very much for the question. So regarding the personal protective equipment, we have received over the past several weeks shipments from the Strategic National Stockpile from the federal government, as well as we have procured quite a bit ourselves. And most of this PPE, just kind of a general rundown, is N95 masks, surgical masks, gowns, gloves, and face shields are the general categories that most of that falls into. all of what we have received has been pushed out. And so we are not stockpiling any of it. We have created a prioritized list of who gets that, starting with our hospital systems, our first responders, as well as long-term care facilities, other city employees, and some of the other requests that we have gotten that have come in. But the key thing with it is everything that we've gotten in, our stockpile remains at zero. As we get these shipments in, we push all of it out to those who need it most.
Mayor Hancock, this is Dave Sachs with Denverite. You mentioned at the top of this press conference testing, and I'm wondering if the city has a percentage in mind of how much of the population needs to be tested and tracked in order to lift the stay-at-home order.
Yeah, I appreciate it. Bob McDonald's going to come and talk about that because that is a very important aspect, I'm sure, of every order in terms of loosening regulations or restrictions, I should say, around the nation. Every mayor, governor will be looking at what target are we going after in terms of testing and how robust will our contact tracing efforts be. And so, Bob, you want to come and give the common thought on that?
Well, the answer is it depends what you read and what you look at. I will tell you that based on my estimations and the population of Denver and the epi curve, I estimate that we would need to do somewhere between 1,500 and 2,000 a week. We are not there yet. We are building capacity with our partners throughout the city, particularly in the medical care setting, but we have a ways to go with that yet before we reach that number.
And will the city lift the stay-at-home order without reaching that number?
We'll have a conversation about that. It depends on how robust we are moving toward that number, and if the impediments to that number are, we can get over them and ultimately find ourselves to the place we want to be with regards to testing.
And
Mr. Mayor,
real quick, Bob, when you say that we're not quite there yet, where are we at as far as testing?
Yeah, I believe the question is where are we? And I don't know that I have, I don't have an update today. I haven't looked at those numbers yet. When I looked last week, cumulative throughout the city, it's in the hundreds. But what continues to be a challenge is not the personnel to manage the test, it's the reagents and the equipment that's needed to do that. So it goes up and down based on available equipment, but it's far short from what's needed at this time.
Ray Solomon, KUNC. Regarding those protective action rooms for people experiencing homelessness, you said that you've secured 550 of those so far, but that you would need over 3,000 to cover the entire population of people experiencing homelessness. And you're prepared to contract for that many. So why have you not yet contracted that many protective action rooms? What are the main challenges to getting those in place?
Yeah, the questions about the challenges to getting the protective action rooms that we need. And so we continue to work with hotels. I'm very grateful to many hotels that have stepped forward. Thankful to the state of Colorado for their efforts and encouragement to hoteliers as well. And what we see still as a pinch point and one of the major concerns is we still have to staff those hotels for this purpose, whether that's security personnel, medical personnel, depending on what the exact needs are for each facility. We continue to need to work to procure the personnel as well as the rooms. We continue to work through the contracting terms with those hotels, but we are getting there and we're getting more steam every day, and we're very encouraged by that.
If hotels haven't stepped up to offer to agree to enter contract with you, have they refused to, or they just haven't stepped up?
The questions about the reasons why people might not be looking to use that. Some facilities, it's as simple as they want to be able to serve their regular guests as soon as orders are lifted. For others, there's concerns about housing persons experiencing homelessness, and for still others, it's looking at their business models and what makes sense to them. So it's a myriad of reasons why some may not, but the more important thing is that I think we're well on our way and getting closer to more and more of the rooms that we do need.
Can I ask about rapid testing and what the mayor has seen from his staff as far as the testing of city workers, how accurate those have been, or have there been a lot of false positives?
Yeah, good question. Chief, you want to also talk about law enforcement on that end, because you guys are doing a lot of that. Let's have Bob come up first and talk about it. Good question, Bob.
Yeah, if the question, I believe, was about the reliability of rapid testing, and I think the focus has been serology tests, not the swab tests for viral load in the back of someone's throat. You know, it's the reliability varies. I believe right now the FDA has given approval for 90 or so to be marketed. That doesn't mean that the FDA has approved their reliability, but they've allowed them to be marketed. We have used some of those tests in the Department of Safety. And, you know, I've said this before when recently asked. We are learning a lot about this virus, and if we can get a hold of some tests that inform us on what we're dealing with and in a way that we can make more targeted decisions, I think as a city we've done that. We've stepped out in front of this. We're going to take advantage of every opportunity we can to include those tests that the FDA has allowed retailers to push out for the purposes that we're using here in Denver. So I can't speak to the reliability of all of the 90 or so tests that are available, but the Department of Safety has been very proactive in using them in a responsible manner, and then following up with swab tests every time they get a positive serology test.
Can you say how accurate they've been in Denver, though, the A2 bioscience test?
Sorry, can you repeat that?
Can Bob share how accurate they've been in Denver, the A2 bioscience test?
Yeah, the ones that have been used in the Department of Safety it's been verified, again, through confirmation of the serology test, over 90%.
Okay, last question, please. Any more questions?
This is Lori Lizarraga with 9 News. I have a question about testing as well. I know that National Jewish Health in Denver has come up with its own test so that it's not reliant on the supplies and therefore isn't affected by the supply shortage of the reagents and so on. Is Denver looking into doing something like that so that we're not feeling the supply shortage so much?
Denver's looking into everything. We're working with medical care community. We're working with private entities that have testing capabilities that they want to share with us. We're having conversations almost daily with many companies that provide those tests, and we evaluate those on a case-by-case basis. But we're going to look at everything we can to learn what we can every step of the way so that our decisions are targeted and thoughtful.
All right, thank you very much.